Access to safe drinking water in Bangladesh has been a major challenge for the poor people of Bangladesh. In pocket areas like Chittagong hill tracts and coastal belts, the scarcity of water is very high. The arsenic contamination of groundwater has caused a proportionate depletion in service coverage for 22% of the shallow hand tube wells being affected in the country. High degree of salinity in groundwater made the life of people living in coastal belt miserable. Groundwater depletion has also become a threat in Bangladesh as the water table is falling gradually due to shortage of fresh water supply from the upstream and over-extraction of water for irrigation. Over the last few years, although the campaign for sanitation and hygiene increased, still there has been an infrastructural scarcity. People living in hard-to-reach areas like hilly areas have been facing severe problems due to lack of water and sanitation facilities. Due to these shortcomings, a significant number of people have been suffering from diarrhea, cholera, typhoid, polio, and hepatitis A and E and other waterborne diseases. Bangladesh is one of the most crowded countries in the world, with a density of nearly 986 per square kilometers. In urban areas, the water crisis is aggravating as projections indicate that more than 50% of Bangladesh population will be living in urban areas by the year 2025. WaterAid is the leading international NGO working in Bangladesh since 1986 and has a total of 20 partner NGOs covering 307 unions, 41 sub-districts and 19 districts in rural areas and more than 700 slums, 3 city corporations and 1 municipality in urban area. The principle of WaterAid Bangladesh is working through local NGOs and local government institutions, ensuring community participation with special focus on inclusion of extreme poor, women, ethnic minority, disabled and other marginalized groups to provide them integrated approach for water, environmental sanitation and hygiene promotion. WaterAid Bangladesh and its rural partners Village Education Resource Center have jointly developed an integrated, participatory and empowering approach in collaboration with people living in rural areas. The approach is called Total Sanitation, which is recognized globally as the Community-Led Total Sanitation (CLTS) approach. CLTS focuses on igniting a change in sanitation behavior rather than constructing toilets. It does this through a process of social awakening that is stimulated by facilitators from within or outside the community. Advancing Sustainable Environmental Health (ASEH) is a major project of WaterAid Bangladesh to ensure safe water supply and environmental sanitation in undeserved and difficult geographical locations such as hilly, low water table areas (Barind), flood-prone river islands or chors, and in areas where alternative technologies such as deep tube wells, gravity flow system to capture and divert spring flow, pond sand filters and rainwater catchments are needed. Funded by the DFID and WaterAid UK, ASEH project began in 2003 and ends in 2009.
Advancing Sustainable Environmental Health Programme does in poor urban communities. It's truly impressive, but rather galling to see a community that's now got maybe 3 latrines between 70 families, whereas before they didn't have any. That's a big improvement, but obviously there's a lot further to go. The reason that the UK has been supporting this programme and its predecessor over the last 10 years is it's an important part of the British government's effort to support Bangladesh in reducing poverty and improving people's lives.
The strength of ASEH project of WaterAid is the formation of more than 15,000 community-based organizations. WaterAid built their capacities in such a way that CBO members can take part in the meetings of the task forces at union and upazila levels and raise their voices. A significant achievement of ASEH is the mainstreaming of menstrual hygiene management in the program approach. Now, adolescents and school-going girls learn about menstrual hygiene from its school sanitation and hygiene programs.
আমি আমার এখানে আমি ভার্গের আগে প্রশিক্ষণ নিয়েছি, নেওয়ার পর আমি প্রতি ক্লাসে একটা টিম তৈরি করেছি 5 জন 6 জন করে। এই টিমের সঙ্গে আমি পরিষ্কার পরিচ্ছন্ন ল্যাট্রিনে কিভাবে যাবে আর কি চ্যানেল পরে এবং পায়খানার পর হাত কিভাবে পরিষ্কার করতে হবে, ঋতুকালীন মেয়েদের পরিষ্কার পরিচ্ছন্নতা কিভাবে থাকতে হবে, এই বিষয়গুলো নিয়ে আমি তাদের সঙ্গে আলোচনা করি। হ্যাঁ, মেয়েদের কাছ থেকে চাঁদা নিয়ে ও প্যাডটা কিনে এবং বাথরুমে তাদের ঝুড়ি ব্যবস্থা করেছি। ময়লা আবর্জনা যদি ফেলা তাদের প্রয়োজন হয় ঝুড়িতে ফেলে।
ASEH also built a number of public toilets in rural haats, bazaars and public places. To ensure total sanitation, the maintenance part of these public toilets is leased out, which not only ensures cleanliness but also created livelihood opportunity for some poor people. Another significant aspect of ASEH is the making of water and sanitation facilities differently able people friendly. WaterAid has been successful in installation of options for differently able people both in rural and urban areas. Adoption of context-specific technology is the root of success for ASEH program. Rainwater harvesting in water-scarce areas, deep-set tube wells and infiltration gallery in low water table and arsenic-prone areas, gravity flow system in hilly areas and pond sand filters in saline-prone areas not only ensured safe drinking water for millions but also saved lives from deadly waterborne diseases.
আমরা চেয়েছি ASEH প্রজেক্টের কার্যক্রম যাতে আমরা চলে আসার পরেও সাস্টেইন করে এবং ASEH প্রজেক্টের আওতায় আমরা যে সমস্ত সুবিধাদি দিয়েছি সেই সমস্ত সুবিধা অর্থাৎ ওয়াটার সাপ্লাই স্যানিটেশন ফ্যাসিলিটিস এগুলো যাতে মানুষ ভালোভাবে ব্যবহার করতে পারে, মেইনটেইন করতে পারে দীর্ঘ সময় ধরে, সেই জন্য আমরা তাদেরকে কেয়ারটেকার ট্রেনিং দিয়ে এসেছি এবং বিভিন্নভাবে তাদের দক্ষতা বৃদ্ধি করার চেষ্টা করেছি। সাথে সাথে হাইজিন প্রমোশনের মাধ্যমে আমরা চেষ্টা করেছি যে তারা যেন তাদের বিহেভিয়ারটাকে আসলে সত্যিকার অর্থেই পরিবর্তন করতে পারে এবং আমরা চলে আসার পরেও যেন এই পরিবর্তিত আচরণবিধি তারা পালন করে আসতে পারে, সেই চেষ্টাটাই আমরা ASEH প্রজেক্টের মাধ্যমে করেছি।
In urban areas, facilities in slums include extension of WASA's piped water supply, installation of tube well and submersible pumps, cluster latrines, sanitation blocks along with menstrual hygiene management facilities, solid waste and wastewater management and so on. In the last 5 years, about 7 million beneficiaries received water and sanitation services from around 82,000 water options and over 1 million sanitary facilities where 206 unions have been completely open defecation free.